Hello, we are Madalena Zheng.
Anna Chuang,
and Alexander Liu.
and we are the creators of Speech to Reach. Today, we'll be presenting our research and development process for an accessible, soft robotic glove designed for not just stroke recovery, but also everyday assistance for stroke survivors with motor impairment and aphasia.
In February of last year, my grandfather suffered a stroke. Overnight, the vibrant and intelligent individual I knew was suddenly confined to a bed, unable to move or communicate properly. This incident severely impacted his motor function, resulting in weakness and slight paralysis in his hand. Though 80% of stroke survivors worldwide suffer from limb paralysis, his only option was a bulky pneumatic glove for rehabilitation that only maintains hand flexibility. After watching him use the device with little improvement or help with everyday assistance, I kept coming back to the same thought. There has to be a better solution.
The primary challenges we aim to address are the widespread impact and accessibility barriers associated with stroke survivors. Stroke is currently the second leading cause of death worldwide, and approximately 1 in 4 people will experience a stroke during their lifetime. Additionally, nearly 30% of stroke survivors develop post-stroke aphasia, a language impairment that can significantly hinder communication and limit access to voice control technologies that rely on perfect speech. While some may eventually recover, others, like Madalena's grandfather, will be stuck with a speech impediment for the rest of their lives. Current stroke recovery devices are limited to rehabilitation, are hard to use, and less accessible for aphasia patients.
Our device is targeted at people of all ages living with mild to severe upper limb paralysis, which is often caused by a stroke or spinal cord injury. Our aphasia-friendly automatic speech recognition model makes our device accessible for individuals with speech impediments. We came across a research paper by Lauren Wagner, Mario Zusag, and Sarisa Bloder on using Whisper to categorize aphasia subtypes, which detailed how Whisper's transcripts can retain enough linguistic structure to analyze a person's speech patterns. The paper proved that Whisper could be used to recognize aphasia speech, albeit with some hallucinations, which inspired our use of aphasia-friendly voice control to control the glove.
When searching for assistive glove for stroke, the results are dominated by rehabilitation gloves, not true assistive gloves. This distinction matters. Most products on the market are designed for passive therapy. They repetitively flex and extend fingers to support recovery during rehab sessions, but don't help users perform daily tasks such as eating or holding objects. This mismatch clearly exposes a gap between what stroke survivors need and what current solutions deliver. The most widely recognized device for hand paralysis is a pneumatic rehabilitation glove. While effective for guided finger exercise, it is bulky, clinic-oriented, and unsuitable for daily use. It does not enable functional independence outside therapy sessions. After testing, our team determined that the glove takes 6 seconds to fully open and close, deeming it too slow and unfeasible for everyday assistive use. Other alternatives, such as functional electrical stimulation or FES gloves, depend on intact neural pathways between the brain and the hand. These devices frequently suffer from overlapping nerve and tendon activation, resulting in unintended movements.
When researching the ways these gloves were operated, we noticed some key issues. We recognized that gloves operated by buttons, whether digital or physical, were not intuitive to use, posing a potential challenge for the elderly. Assistive gloves operated by automatic speech recognition systems could only detect perfect speech, making them inaccessible for users with aphasia.
We reached out to 9 stroke support groups with a survey to determine proof of need. When provided with a description of our device, 75% of respondents viewed the product very favorably, and 25% viewed it favorably. This demonstrates strong interest and positive reception among the target population, providing evidence of market need and validating the potential value of the device for stroke survivors.
Through the survey, we also determined that individuals with severe hand paralysis reported that they wanted independence with daily tasks, such as feeding themselves and carrying or lifting objects. On the contrary, individuals with mild hand dysfunction expressed a desire to increase their finger dexterity. Additionally, comfort and portability ranked the highest on the list of important factors, followed by ease of use and price, respectively. And we made sure our design aligned with all of their needs.
Our current prototype is a 3-in-1 product consisting of a soft robotic glove, an aphasia-friendly speech recognition model, and a complementary app for training and tracking. The soft robotic speech-to-reach glove prototype was handmade from 0.8mm silicone sheets and designed to be breathable, ergonomic, and lightweight. The nylon fishing wire is routed through metal crimps embedded at 5 anchor points, mimicking the natural tendon structure of the hand. This design is more lightweight and breathable than the bulky pneumatic gloves on the market. By maximizing the amount of exposed skin, we allow users to maintain skin dexterity while handling objects. Speech-to-Reach conduct a topical 3D scan of the customer's hand to ensure a highly personalized fit. The motorized component can be attached to a belt or wheelchair, connecting to the glove through a cable sheath.
After testing alternatives, we return to the trusty pulley system to operate our glove. The process of actuation begins with a target position on the Raspberry Pi, which calculates the exact number of motor steps needed for each finger's movement. The RPI sends GPIO signals to a Yell-In 2003 driver, which powers 28BYJ48 stepper motors for the precise rotations required for finger movement. Since the wire is arranged in an antagonistic pair around motor-driven pulleys in opposite directions, motor rotation produces controlled finger extension and retraction, allowing the glove to accurately reach the intended position. Our system integrates 3 AI models to enable intuitive, personalized, voice-controlled hand rehabilitation. The first is an ASR-based model, selected for robustness to accents, background noise, and real-world conditions. We use OpenAI Whisper, trained on 680,000 hours of diverse audio, as a strong general-purpose foundation. To address ASR's inability to accommodate speech impairments, we introduced a personalized adaptation layer that operates alongside the base ASR, incorporating constrained vocabularies, per-user calibration, and error-tolerant interpretation, allowing individuals with varying degrees of aphasia to operate the device by adapting to them. A third prompt-based large language model translates recognized user intent into precise finger-level motor commands. Together, these models form an end-to-end pipeline from natural speech to physical movement, with individualized speech adaptation as a core proprietary innovation.
The system is delivered through a simple app with interfaces for patients and caregivers, with specific features tailored for each individual. This is the patient dashboard. This is the caregiver dashboard.
Though our current prototype demonstrates proof of concept, we are currently facing some technical barriers preventing us from fully completing it. The plastic fishing wire creates extreme friction when threaded through the cable sheath, preventing the glove from being able to move when fully assembled. Our first step will be to create a new working prototype with high quality materials and 5 fingers instead of the current model, which has 3. The current model does prove that fine-tuning an ASR model to aphasia speech is possible and that a pipeline can be created, but we lack the sample data to fully test and refine it. Next steps would be to test its use in real-world situations and to further refine and improve the model. After a complete prototype is assembled, we plan to obtain FDA approval and begin conducting clinical trials. We will further modify the device based on user feedback to optimize its effectiveness. Finally, we plan to bring our product to the market by partnering with manufacturers to mass produce our product for patient use. We plan on raising awareness about speech to reach by partnering with hospitals and stroke organizations, as well as attending health conferences. Thank you, and you can explore our website you can explore our device on the website here.